Also tonight, healthcare professionals everywhere are not training to help Ebola patients without becoming infected themselves. But one of the big complaints coming out of Dallas is that the guidelines keep changing. So what does that mean for those on the front lines of this battle? Well, Marcia Bonhart asked that question today. Marcia, what did you learn?
Well, Mark, in the words of a local public health official, everyone should keep up with what's going on with Ebola because the situation is very fluid. And an example of that is how overnight the state of Ohio Health Department has enhanced Ebola guidelines. Ohio became spotlighted in the Ebola crisis when a Dallas, Texas nurse cared for a man who died from the virus. Then that nurse, Amber Vinson, traveled to see her family in Akron by way of the Cleveland airport. The day she returned home to Dallas, she was diagnosed with Ebola.
Almost all of those people are healthcare workers who've been very involved with the original person that had Ebola, and as a result of being involved with all of their body fluids and their very high viral loads, they were exposed and they have come down with it. The only way you get Ebola is to be exposed to the body fluids.
That was what Bill Horton from Public Health Dayton-Montgomery County said Wednesday. One day later, the Ohio Department of Health issues more aggressive guidelines.
What we're saying is we want to take precaution for anybody that may have come in just direct contact through, you're at a handshake, a sneeze, anything that we know about that person, and we are just following up.
Amato says because Amber Vinson traveled in the Buckeye State, Ohio has tightened its recommendations.
We want Ohioans to be concerned, but to not panic. We want them to be aware that this person did come through our state, that did test positive for Ebola later, but to not panic because the chances of them getting Ebola are very, very small.
But it's clear the newer Ohio guidelines tell you that a handshake with an infected person means a recommended 21-day quarantine.
Again, it's just an over precaution from the state of Ohio to make sure that everybody is safe and aware of.
Now, the department emphasizes you are not at risk unless there is contact with body fluids. As more is learned about the virus, directives can continue to change. Marcia Bonhart, 2 News working for you.